I'm going to die. You're going to die. Prior to your death, you may experience a health crisis that will leave you unable to communicate. As an emergency room professional healthcare provider, I have seen this happen. I've also seen the stress and confusion experienced by family and friends when they were called upon to make decisions for their incapacitated loved ones. Did you know there's a way to communicate your treatment wishes even when you're incapacitated? This can be done through written statements and documents called advance directives that you prepare prior to experiencing a health crisis. Advance directives allow you to determine the amount and type of health care you wish to receive in a crisis or end-of-life situation. They take different forms, and laws about advance directives vary from state to state. Although a state may legally be required to honor your advance directive that clearly states your wishes, it is best to have a form from that your particular state recognizes. Most states, including Colorado, have resources available online that can be downloaded to guide you through the preparation process. Having these documents will make sure your wishes for medical treatment are known and honored should you become unable to express them yourself. Today we will discuss 3 important steps for preparing your advance directives: determining your wishes, choosing a healthcare provider, and creating a living will. Gathering information is the first step in deciding your wishes for care. Understanding the medical issues that form the basis for making healthcare decisions is crucial. Scenarios such as brain death, brain damage, coma, and persistent vegetative state are not ones that we deal with on a regular basis. Likewise, terms such as organ-sustaining treatment, mechanical ventilation, defibrillation, and artificial hydration are not terms encountered on a regular basis. Naturally, when we are encountered with these, we have questions and concerns. Speaking with your physician can help you understand the concepts as well as learn the benefits and burdens of each treatment option. Many forms of medical intervention are available, and some of them can help sustain life, but not restore organ function or cure terminal conditions. 2 main questions that may help springboard the discussion-making process for treatment procedures would be: first, is the medical condition reversible or irreversible? And secondly, is meaningful recovery possible or unlikely? If the prognosis is good, life-sustaining treatments may be a bridge to recovery, and these interventions may be implemented for a trial period or a short period until recovery is reached. If recovery should fail, it could be stopped. These life-sustaining treatments can be stopped. If the condition is not a reversible condition and meaningful recovery is unlikely, my choice may be to refuse life-sustaining treatment or to implement them for a specified time so that family members can come to say goodbye, or to allow for my organs to be donated. The 2 primary classifications of treatments to be considered are organ-sustaining treatments, which can include a set of drugs, medical procedures, and medical machines that can keep a person alive for an indefinite time. The other option is palliative care or comfort care. It's an option chosen by many individuals in the end stage of life. It's also known as hospice care to many. This type of care is in place to relieve pain, breathlessness, and also other distressing symptoms. I have only mentioned a few scenarios and interventions to consider when deciding your wishes, because there are so many possibilities, it is important to discuss these options with your doctor for clarification and guidance purposes. Deciding your wishes alone is not an advance directive. It is a preparation step needed for drawing up the legal document. The second step is choosing a healthcare agent to speak for you when you cannot. A healthcare agent is someone you have chosen to make healthcare decisions for you if you are unable to do so. Your healthcare agent has all the powers of decision making that you do. He can consult with healthcare providers. He can review or get copies of your medical records. He can make all healthcare treatment and placement decisions. The agent must act according to his or her understanding of what your wishes and preference would be, and to set aside their own values and preferences to do what you would do. In Colorado, no one is given automatic authority in decision making for another adult, except in cases of emergency. If you have not appointed an agent and you experience a healthcare crisis, leaving you unable to communicate, a proxy decision maker will be appointed for you. Interested parties, such as family members, spouses, life partners, and close friends, determine by consensus of this group who will serve as your proxy for the individual that's ill. When the crisis is over and you can again make your own decisions, the proxy no longer has authority. The proxy's authority is not durable. The preferred method for choosing your healthcare agent is with an advance directive called a medical durable power of attorney. This is a legal document you sign naming an individual as your healthcare agent. When considering your choice for a healthcare agent, it is important that the person is a legal adult that you trust. They need to understand your wishes and be comfortable with implementing them. They can't be too emotionally involved to make important decisions, and this person will need to manage potential conflict that might arise among family members. So, it does need to be someone that you trust. The medical durable power of attorney is a place where you record your wishes. When your wishes are added to this power of attorney, the decisions you made about your care become a legal document making your wishes enforceable. And the legal document is an advance directive. A medical power of attorney can be implemented whenever the patient chooses to have their healthcare agent make decisions on their behalf. It can be from this date forward, or anytime the patient is unable to make his or her own healthcare decisions. It is durable because it remains in effect until the patient revokes it. While the medical durable power of attorney is an advance directive, it is not the same as the more commonly known living will. While the information contained in the medical durable power of attorney is enforceable in any health crisis, the living will is not. It is an advance directive that goes into effect 48 hours after two doctors have determined that you are either in a terminal condition and cannot make your own decisions, or you're in a persistent vegetative state. A living will is also considered the document for communicating your wishes for the types of medical care to accept or refuse during your remaining days, and a place to record your choices about your funeral, burial, or cremation choices. The medical durable power of attorney and the living will are two main advance directives that healthcare professionals recommend patients have in place should they become incapacitated. In the state of Colorado, if you are admitted to a healthcare facility for treatment or an outpatient procedure, you should be asked if you have an advance directive and offered assistance in preparing them if you do not. Since most of us are young and healthy, it is difficult to imagine that we will face a health crisis. Thinking about our death or our wishes if incapacitated is very emotional and we avoid thinking about it. In reality, we should at least take the time to discuss these issues with our loved ones. Advanced directives allow you to determine the amount and type of health care you wish to receive in a crisis or end-of-life situation. The Colorado Hospital Association has made the process of creating advanced directives easier. They have published a booklet complete with forms to walk you through the process of making your own legal advanced directives. Having these documents will make sure that your wishes for medical treatment will be honored should you become unable to express them yourself.